I'm delighted today to welcome to the GPHI podcast Dr. Kathi Norman, who is here with me right now. Kathi lives in Portland, Oregon. She's a physician assistant and currently practicing in the area of psychiatry. Not only that, Kathi also has two master's degrees, one in medical science and one in positive psychology. So it's a great pleasure to be here today with you, Kathi. Thank you for joining us for the podcast. We are, of course, on different sides of the world. I'm on the east coast of one country. You're on the west coast of another country. And there's a metaphorical ocean that, or there's actually a literal ocean that separates us, but yes. Metaphorically we're on the same page. So. I'd love to start by asking you what drew you to positive psychology initially?
Well, first of all, let me say thank you so much for allowing me to be here. I'm delighted, and this is the first time we've been face to face, so I'm so happy to finally see you face to face, Simon. Thank you. It's a little bit of a long story, so I just want to clarify as a physician assistant, for those viewers or listeners that don't really know what that is I practice medicine like a medical doctor would. I just don't have as much background with schooling. I'm currently, as you said, practicing psychiatry, but I have practiced medicine in some form or another since the mid-1980s. When I learned that there was just some type of a discrepancy, I just felt like we were missing something in the practice of medicine, and I wasn't really sure what it was for probably a decade or so. I just, by some random fortune, received an email from the University of Pennsylvania, and it was advertising a summer program where Dr. Tal Ben-Shahar would be teaching it. So I'm like, let me explore this positive psychology thing, and that was like over 10 years ago. And I loved it, and I'm like, I feel like this is the piece, but I don't feel like I have enough information. I was aware of the PEN program, which is the Masters of Applied Positive Psychology, where Marty Seligman was part of that and would be teaching. But I also knew that Dr. Tal Ben-Shahar had a certificate program for 1 year. So I decided to take that route initially. And so I just studied and studied for a year, lectures and classes. And there were a couple of physicians that were in the certificate program at the same time. And they were just lost like I was, just trying to make sense of it. And this is where I was first introduced to ECLM. Actually. So one of the physicians was going to be moving on to that next. I put that on pause, and at the end of that year, played around a little bit, tried to figure out how I was going to take positive psychology into the practice of medicine. And by this point, I was already calling it positive medicine, which I've since trademarked and is my baby. So I decided I didn't have enough information. I wanted more research, because in the practice of medicine, anybody who practices medicine knows we need evidence-based. And at that point, we were really getting enough evidence-based medicine and research that we were able to start using some of the tools that they were finding. And so I applied, got accepted, and completed the master's program at Penn. Started playing around, and still didn't feel like that was quite enough. The concept of this master's program at Penn is applied. They take people who are in different disciplines, such as business, law, coaching, or medicine, such as me, and they want us to learn about positive psychology and just take that out into our practice. So that's one of the things that was very attractive about Penn for me in that particular program.
So you had a relatively early introduction to the union, if you like, between lifestyle medicine and positive psychology, and I'm intrigued by you've made reference to this idea of applied. Share with me an example of a way in which you might apply this in your psychiatry practice.
Oh my gosh, every day, all day long. So one of the things that I do in my practice, we have intake. So I see my patient, I evaluate them and get an idea of what their diagnosis is and what a treatment might look like for them. And that might include medicine. But it also includes, and they know from the very day that they meet me, that every time we're together, we're going to talk about lifestyle medicine. We're going to talk about positive psychology.
Mhm.
We're going to talk about PERMA, which I've pulled the relationship part out of that. So my pillars of health, I actually think is a bedrock, and it's relationships. It is protecting sleep, and this is where the lifestyle medicine comes in,
Mhm.
nutrition, and it is moving the body. And so every time I see a patient, I ask them, what have you done in this past week toward the bedrock or the pillars of health, the relationships and protecting sleep?
Mhm.
Sometimes they need to have a sleep study. Sometimes they need CPAP. So that's one
Mhm.
of the
Mhm.
ways.
I love that idea that you've shared of protecting sleep or guarding sleep, because
Mhm.
that's the situation that a lot of us find ourselves in, isn't it? That sleep is that thing that often at our own discretion
Mhm.
gets encroached upon,
Mhm.
and so having that mindset of guarding that time, setting that time aside as valuable, is really important. What about you, Kathi? What about outside of your professional work? I wonder whether you could share with us an example of um, how you might apply some of these ideas in your own life. I suspect you're very good at guarding your own sleep, and I suspect
I
you're
am
very
a
good at
professional
connection and
sleep
nutrition.
protector. Yes, yes. I'm not sure about the nutrition. I do like some snacks, but I do. I do need to set an example. Well, so let's just say lifestyle medicine. I'm standing right at a electronic
Mhm.
desk that I can raise up and down. Right below
Mhm.
me is a walking pad, so that
Uh-huh.
I work from my desk in psychiatry. I do telepsychiatry, so I always have the option to be able to move my body, even though I am sitting or in front of a screen throughout the
Mhm.
day. I make sure that I go out on a daily basis and do something that I enjoy. Everything
Mhm.
around me has meaning in the back. Many things in front of me have meaning.
Uh-huh.
Um, in positive psychology, there's this thing called a positive portfolio that I use with my patients, and we'll go back to the positive psychology part with my patients and myself. And it's just really being aware and looking at the things around you that inspire you. And many times, this is a way that I get patients to start thinking about what brings them joy in their life.
Mhm. Mhm.
And that's this positive portfolio where they just
Mhm.
go out and they find just a few things. It might be a scarf that they made with their grandmother. And then
Mhm.
I have them talk to me about it. And then all of a sudden something just shifts and they start realizing I can feel joy in my life.
Mhm. Mhm. I wonder if you could, having spoken about the things around you that have meaning, I wonder if you could let your eyes settle on something at random, share it with us,
Yeah.
and share the meaning it has for you.
Yeah. Well, I mean, this, I won't go behind and let you see my back, but so this right in front of me is a bird calendar that my
Uh-huh.
girlfriend bought for me.
Uh-huh.
And so it's already, so Wednesday, May 31st. She knows I'm a crazy bird lady. I
Uh-huh.
love birding and I love it so much that I have when I go on my hikes, and I'll show this to you, and I hope somebody can get some kind of benefit out of this. But what will happen is that I can use this app that records birds that I hear when I'm out walking, and it'll tell me what birds are. So this is like from Cornell, and so now I know all these birds are around me. So
Look at that. Look at that. And that bird that was on the calendar that you just showed, what is that bird? It's a parrot of some sort.
I don't know. It's probably not from my area. It is a green-rumped parrotlet.
Uh-huh. Uh-huh. Yeah, wonderful.
Yeah.
Wonderful.
Yeah.
Look at that.
So yeah,
Wonderful.
so those are, but I mean, I have handmade things from people behind me, my kids and
Mm,
such. But thank you
mm,
so
mm.
much for asking
Yeah.
because yeah, this if we're going to be in our space for a long period of time, we want it to be meaningful.
Yeah, yeah. That said, I wonder if you can share with us some advice that you might also want to share with your colleague medical and health professionals
Yeah.
that would support them to thrive and do well in their own lives.
Well, I do have one comment, and I want to keep that for an end comment. But
Mhm.
I really encourage medical providers to join ACLM, to join the Global Health Initiative, to join IPA. We have a health and wellness division. And the reason I bring that up is because you get to meet the people or learn about the people who are doing the research and the work. And so that you might be drawn to something. I mean, my journey has been long, and it has been very hard and very personal. And so I'm not sure what is going to attract other people, but what I can say for sure is that there is a lot of research to support the practice of positive psychology in the practice of medicine. And so just, I recommend possibly picking up Flourish by Marty Seligman, because that's kind of like the anchor, kind of introduces you, or the work of Tubin Shahar, Happier book. And then just, we have a health and well-being division with IPA. We're trying to get CMEs for physicians or medical providers. And that way, you can talk to the people who are already in it, doing the work. Don't hesitate to reach out to people that are the researchers if you're interested in a particular topic. Barbara Fredrickson's Broaden and Build. We know with positive emotions, people are more open to change and information and experience. And so there's so much out there now. Just my recommendation is just to be open to joining some of these associations.
What I'm hearing in what you're sharing, Kathi, is that you're really committed to building an infrastructure into medicine and healthcare that has these elements present, making this part of the landscape for everyone.
Yes,
Yeah.
I've been part of the IPA Health and Wellness Division leadership team for a very long time, and we've worked very, very hard and as the folks in the Global Health, Positive Health Initiative has been working for so long, for so many years. And so it would just, we're here, we've got the information, we've been doing it, and we love to share.
Well, Kathi, I wonder, a moment ago you mentioned that your own journey had some challenges, and I wonder whether there's perhaps a challenge that you would be happy to share with us. And in particular, I'm curious to understand how you managed that, how you got past that challenge, what it was that you brought face to face with that challenge that enabled you to be standing here right now.
Well, there are a lot of challenges, but one comes to mind. And I was in the MAPP program, and actually my advisor was this wonderful person that was very helpful, but I was needing to write a paper and present this topic to a group of physicians that were emergency room physicians, and it was all about patient care and these different positive psychology things that we could do to help patients. And I was, really close to the emergency department medical director. So he came over and he was looking at my presentation, and he was going to sleep. And then all of a sudden I mentioned something about burnout in physicians, and he sat up and he engaged, and I was like, oh boy, I'm in trouble. I had to start from scratch. So I knew that to get the attention of the medical providers, I needed to talk about them and give them something, because they were burning out and they were just in distress, and they really were. And so I just had to call my advisor, and I'm like, hey, I've got to do a big change right here and do some research and start focusing on provider burnout.
Well, I wonder, extending that idea, Kathi, I wonder whether you could say something about your understanding of the links between good patient outcomes and provider burnout, and the extent to which positive psychology and lifestyle medicine might actually be something that addresses both simultaneously.
Yeah. Well, we know through research that providers that are happier, have positive emotions, the nurses want to be around them. They make quicker, more accurate decisions when it comes to patient care and diagnoses. And well, heck, patients just like them better. And so, of course, there's going to be better health outcomes for patients because of that.
Yeah, wonderful, wonderful. So it's to return to an earlier part of our discussion, it's the stone that kills two birds. Not that we would want to kill birds, but
Mhm. Yes.
but we can do two things at once here.
Yes, yes.
Yeah.
And the medical providers have all of the information about like what can we do in the practice of medicine, because we've been taught that, and so we're getting that down pat, but we just need to get that extra component of positive psychology, stress reduction, walks, and all the preventive type things that we can do through like the lifestyle medicine.
Mm-hmm. 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 Wonder whether you could, Kathi, share with us a favourite resource of yours. Maybe it's a book, maybe it's a podcast, maybe it's a patient inventory. It really doesn't matter what it is, but something that you have found extraordinarily useful in your own practice, and something that you would want to recommend to others.
Ooh, ooh. I don't think there could be one thing. There's so many. I will tell you, maybe if you would allow me, a couple things that were a little
Of
bit
course.
shocking.
Okay, please. Shock me.
Gratitude. Talking to my patients in the practice of psychiatry and talking about gratitude, you can see physical shifts. It is amazing when we start talking about gratitude with our patients, and volunteerism. So
Tell us a little bit about the mechanism that you see at play there. What's the mechanism that drives gratitude and volunteerism and good outcomes?
I think that with gratitude, that when they start practicing it, they feel better and they pay attention, and they're like, I feel better when I do this. I want to do it more.
Mm-hmm. Mm-hmm.
And
It
I think it's that simple.
becomes a virtuous circle, rather than
I teach the patients, what does it feel like in your body? Is that like, how do you feel about this? And they pay attention. They want to feel better.
Mm-hmm. Mm-hmm. Is it, say some more about that? The idea that fundamentally people want to feel better or want to feel good, and I'm interested to hear your ideas about that as a driver of well-being.
That they want to feel better. Well, I guess. Well, patients come to me, and even when I was working the emergency department as a medical provider, I think that patients just lose hope, and some just don't have the skills. They don't know how to dig themselves out. They know they want to feel better, and sometimes they come completely hopeless when they come to see me. And when they start feeling better, they want that, and so they're willing to do what it takes to start feeling better, even if it's incremental and slow. Sometimes it's big steps.
Kathi, I have a question which I'm going to break into two parts, if I may.
Yeah.
The first part is, what's an idea in healthcare? A given, if you like, one of those things that we rarely examine, but an idea in medicine and healthcare that you would love to see retired. It's a concept or an idea or a practice that you would love to see retired.
That the brain and the body aren't connected. When I started practicing medicine, if you try to talk to a cardiologist about a patient having chest pain and they have stress, it wouldn't go over very well. I really think we need to move the practice of medicine with the understanding now that, like, just getting rid of the fact that stress does not cause physical symptoms, because we know now that it does. And let's move that and start exploring like what's happening in the body. And I'd like to move that forward. When I have a research paper on forgiveness that's out there that talks about what happens in the body when we practice in forgiveness and anger. And so I'd like to just retire that part and then move forward with examining how does mental health affect the body.
And so that's you've kind of answered the second part of the question one way. How does let's move forward with how does mental health affect the body. What's another idea that you would love to see introduced into medicine and healthcare? Something that's not quite there yet.
It started. I think that institutional support for mental health, for medical providers, for medical boards to just kind of release and relax some of their questions when, doctors and medical providers go to fill out the application for the state license. Just paying attention that it's okay for medical providers not to be okay and to have, stress and anxiety and mental health issues, I think I would like to see institutions or maybe schools, medical schools, physician assistant, medical schools, putting in their curriculum. And again, some of them have already done this about burnout, about mental health, about self-care, and how do we find that support for even the medical students? Because we know that, the second year of residency is the highest incident of medical doctor suicide. So it's really important that we take care of the providers and teach them how to take care of themselves. Get rid of the stigma.
And part of what I'm hearing in that is a shift away from seeing, mental health challenges as something that might disqualify someone or limit their practice in some way, and rather see it as view it compassionately as a challenge at which we need to throw some resources and get better at managing.
Yes, thank you.
Yeah, wonderful. Kathi, if you were to, I mean, we're in a short space of time, we've talked about quite a few things here, and perhaps this next question will draw out even another new idea. Let's imagine that someone is listening to this podcast. Perhaps they're a physician, perhaps they're an allied health professional, perhaps they're a community member. What's the one thing? What's the one idea that you would love to know that someone had taken away from this?
To pay attention. Just pay attention. Pay attention to your children. Get off of the computers. Get off of your phones. Watch your daughter's basketball game so that she doesn't jump up on the bleachers and say, "Hey, Mom, how did my game go?" And you missed the whole thing. So pay attention to your children. Listen, engage, enjoy, because all we have is this moment.
That's really plugging into that social connectedness pillar of lifestyle medicine, the importance of relationship, which I think how did you describe those initially? The bedrock.
So there's the pillars of health that people talk about, and they're described as different pillars of health, but mostly it's protecting sleep, nutrition, and movement. But I've added relationships, which comes out of the PERMA model, building, cultivating healthy relationships. So I think it's a bedrock, and yes, I think that one day our children are going to be grown and gone, and when we look back, we're really going to want to have really nice thoughts that we were present and enjoyed the time that we had with them. Friends, wonderful. Family, all of it.
Yeah. Connect here now.
Yes.
Yeah. Kathi Norman, thank you for a delightful discussion around some ideas of being connected, of what it means to move, thinking about those inextricable links between brain and body.
Yes.
Of course, remembering that it's all part of the one system. Thank you to our listeners and watchers as well, and followers of the Global Positive Health Institute. Please subscribe to the channel if you haven't already. It's very easy to do. We do hope to see you again for another episode of the podcast. Be safe, be happy, be well. Kathi, once again, thank you so much for your time today.